Hello, Mrs. Smith. My name is Katrina, and I will be your nurse today. Before we get started, can you verbally verify for me your full name and date of birth?
Katrina Smith, 2004, September 3rd.
Awesome. And is Miss Smith all right, or do you have a preferred name?
Just Miss Smith is fine.
Okay, so what I'm going to be doing for you today, we are going to be inserting a urinary catheter. And what that's going to do is going to help you with voiding, also known as urinating, okay? I'm going to get you to a comfortable working height. Lower this. Awesome. Alright, before we get started with that though, we are going to begin with some perineal care, okay? We're just going to clean you up just a little bit and prepare you for the procedure.
Okay.
Alright. Are you comfortable, Mrs. Smith?
Yes.
Okay. Alright, so we are going to get you into dorsal recumbent position. Can you do that on your own by putting your legs up, or do you need assistance?
I'll need assistance.
Okay. Alright, so we are going to lift up this bath blanket along with your gown, trying to ensure privacy. I already checked the patient's health records. This is what was ordered for her. Curtains are closed for privacy. I'm going to get her into dorsal recumbent position now. Alright, and then first we're going to get this chest pad underneath you. Do you mind lifting your bottom up for me really quick?
Okay.
Awesome, good job. Alright, so we're going to begin with some perineal care, okay? So I already have my soap and cleaning agents, and we're just going to begin with cleaning it, alright? Awesome, alrighty. Then I would dispose of this properly, putting the used washcloth in the used linen thing, and then we're gonna pat dry. Awesome, and I would also dispose of this appropriately. Good job, okay. Alright, so now we're gonna get started, okay?
Okay.
Do you have any allergies to latex or iodine, perchance?
Iodine, not
Iodine?
latex.
Nothing else?
No, ma'am.
Alrighty. Alright, I think I need some bigger gloves, Mrs. Smith, don't you agree?
I do.
Alright. There we go, much better. Alrighty. So we're gonna set this down right here. I'm gonna have you open your legs just a little bit for me. Beautiful. And then I'm gonna make this into a little trash bag, and I'm gonna set it by your legs. Just do your best not to knock it over for me, okay?
Okay.
Alright, we're gonna set it right here. Awesome. Perfect.
Now we're going to insert the catheter. I want you to take a deep breath and go down.
So we're gonna have the shiny side down. We're gonna place this right underneath you. Okay. And then we'll also have the shiny side down for this as well, which is this side. It's right in between. All right, are you still doing okay, Mrs. Smith?
Yeah, I'm okay.
Beautiful. All right, now I'm gonna get set up. Okay, so the patient is allergic to iodine, so I'm gonna throw this away. I'm going to get my syringe set up. All right, first I'm gonna fluff my cotton balls. Awesome, and then I'm gonna open the hydrogen peroxide and pour that over the cotton balls and dispose of that. I will also be opening the lubricating jelly, putting that over here. Beautiful. All right, and then I'm gonna set the tip of this into the lubricating jelly about 1 to 2 inches deep. Okay, so now we're gonna begin with cleaning.
Are you comfortable? Yes. I'm gonna hang your urinary drainage bag on the face of the bed with you.
Awesome.
I would cover you
And
back
then
up. This is
I'm
where
just gonna throw the rest of these away, they're not needed.
should go into that right away.
Dispose of that.
And
All right.
my gloves first.
Mrs. Smith, do you require any analgesics before I get started?
No, thank you.
All right, let's get started. Okay, so I'm gonna move this a little higher up. Great. All right, so this is gonna be a little uncomfortable, okay?
Okay.
Just bear down as if you're voiding, okay?
Okay.
All right. So it's 2 to 3 inches in, and I see urine flowing, so now I'm able to continue, and we'll go 2 to 3 more inches. Awesome. All right.
Ask you if you wanted period.
Now I'm going to insert to make the bubble inside of it. Good job. And then I would dispose of this, but I will be needing it for removal, so I'm going to place it right here. And then I'm going to set this with my clean hand over the patient's leg and now dispose of everything. Great job, but before I do that, I'm gonna pull it for some resistance. Until I meet resistance, that means that it's inflated inside, and now I'm ready to clean up. Okay, so we're gonna remove my gloves after we get all the trash in the area right here. Okay. Then I'm going to remove my gloves using proper technique and perform hand hygiene. I would also offer any perineal care. So, Mrs. Smith, do you require any perineal care?
No.
Awesome. All right, you did really, really good. Now I'm just going to finish setting you all up, okay?
Okay.
All right. So we're going to place this on top of your leg to keep your urinary catheter in place. Is that comfortable for you?
Yes, ma'am.
Awesome. Awesome. All right, we're gonna get you into a comfortable position now. And I'm going to place your guardrail up before I hook your urine bag on the side of the bed. that can move with the bed. Alrighty. I would cover the patient back up, get her back into a comfortable position, perform PPE again. Awesome. You did really, really good, Mrs. Smith, and now I'll help with the removal. So the patient's health history is already checked. I already asked the patient if she had any allergies, and the patient's already verified she has no allergies. This is the correct patient. And the order today, Mrs. Smith, is to remove your urinary catheter, okay?
Okay.
So what we're going to do first, we are going to check your urine contents, okay? So I'm just going to place this down here. And if the cameraman wants to move over here so then they can see. Awesome. Alright. So with my collection container, we're going to measure the amount of urine collected from this catheter. So I'm just going to remove this off of you. Do your collection. And measure this. Awesome, it is fully drained. And the urine is dark yellow in color, a copious amount, and there's no apparent odor, and I would dispose of this in the proper way. Right? And now I will be assisting in your removal, okay?
Okay.
So first we're going to get this attachment off of your leg. You're doing all right, Mrs. Smith?
Yes, ma'am.
All right, so we're going to take this off right here. And unstrap you. So what I'm going to do now, I'm going to place the syringe back into the port and have it gradually take out the fluid through gravity, which is shown right here. But for the sake of time and the video, I'm just going to pull it.
Oh no, the one after that's for just tomorrow. And then the hospital.
Awesome, right, so it's all out. Now I'm going to take this out, dispose of it properly in the trash, and I'm going to open her legs back into dorsal recumbent for an easier removal process. All right, so now that all of that is done, Mrs. Smith, are you ready for me to take it out?
Yes, ma'am.
All right, so I'm just going to ask you to take a deep breath in and hold it for me. Are you ready? One,
Yep.
2, 3. Good job. You did so good. We're going to take all of this and dispose of it. And here I would also offer some hygiene, perineal care. So Mrs. Smith, do you require any of that today?
No, thank you.
Awesome, so we're going to get her back into a comfortable position. First, placing the gown down. Removing the bath blanket and disposing of it into the soiled linens. Make it all nice and comfortable. Alright, you did phenomenal today, Mrs. Smith. I'm lowering the bed. The call light is in place. The wheels are locked. Alright, the bed is in the lowest position. Thank you very much, Mrs. Smith.